our podcast today entitled Pivotal Moments That Changed the Trajectory of Eye Health. At the Vision Impact Institute, we're dedicated to raising awareness about the importance of vision correction and protection to make good vision a global priority. In order to accomplish this mission, we partner with like-minded organizations that challenge the norms of eye care and the provision of eyeglasses as a solution. Today, we'll talk to some of those leaders who have significantly influenced some of these most pivotal moments in eye health. We will explore some of the potential commonalities between the inclusion of trachoma into the neglected tropical diseases global agenda and the inclusion, most recently, of eyeglasses into the Assistive Technology's global agenda and disabilities movement. Our first speaker today is Dr. Serge Resnikoff. Serge is an international expert and consultant in global health, ophthalmology, and eye health. As a powerful global health advocate, he's developed his work and devoted his work to highlighting health issues through corporations, through the WHO, through local and national governments and academic settings. From 1999 to 2004, he led the WHO's program for the prevention of blindness and deafness to make essential eye and ear care available to all. Then from 2004 to 2008, he coordinated various WH programs aimed at preventing and managing non-communicable diseases such as cancer, diabetes, cardiovascular, respiratory, genetic, ear, and eye diseases. From 2008 to 2010, Serge served as the CEO for THE, a European pharmaceutical group specialized in the research, development, and commercialization of ophthalmology products. Serge is a visiting professor at the University of New South Wales in Sydney and also teaches in Geneva and Paris. He devotes his time as the chair of the International Myopia Institute Board, the chair of our Children's Vision Advisory Board, and the president and chair of OPC, an NGO active in the prevention of blindness in Francophone Africa. He is also a highly esteemed member of the advisory board for the Vision Impact Institute. Serge has published over 200 peer-reviewed articles and book chapters to date. So thank you so much for joining us today, Serge. As always, it's such a pleasure to speak with you.
My pleasure.
So to start today, perhaps you could just give us a quick snapshot of the history of trachoma elimination before it was included in the neglected tropical disease agenda. What were some of those challenges that you faced?
Trachoma elimination programs started very, very long ago. And even when WHO was created in the late 40s, elimination of trachoma was one of the main objectives of WHO at that time. And then trachoma became like a disease with very little interest to the global community, and only a small bunch of people kind of kept to be interested and tried to do something happening. The main event, or the main thing that happened that really had a huge impact, was the finding that azithromycin, a very widespread antibiotic, was active on trachoma with a single dose. And that was kind of the first step. The second very important step was when Pfizer, the drug company was producing most of the azithromycin in the world, decided to make a donation to eliminate trachoma. And that has really had a tremendous effect, because then it was like, we have the solution, we just need to implement it. And the point was that there was very little resources available for that. So it was a very kind of frustrating time when the drug donation was available, but there was no funds for providing these drugs in the 50 plus countries that were in need of receiving treatment. And that's really where we were before the NTD movement started.
Okay, so tell me a little bit about what led to the NTD movement and trachoma's inclusion there.
The NTD movement somehow started much later than what I was discussing about the drug donation. It mainly stemmed from the point that a number of people started realizing that there was an absolute imbalance between the resources that were made available by the Global Fund to fight against HIV, AIDS, TB, and malaria on the one hand, and the rest of the tropical diseases, and especially those for which some treatments were available, some for which drug donations were available. And so at the beginning, the NTD movement really started as making the point that a lot can be achieved with actually very small amount of money per person, and also making the point that actually the number of people affected by the neglected tropical disease were actually much higher than the number of people affected by the three big conditions that are part of the Global Fund. And at that time, trachoma and onchocerciasis, I mean, two diseases affecting the eyes, were very much in advance compared to the rest of the neglected tropical disease, such as schistosomiasis or soil-transmitted ailments or lymphatic filariasis. So, in a sense, trachoma and the WHO Alliance for the global elimination of trachoma by the year 2020, and the ICTC, the International Coalition for Trachoma Control, were forerunners, and the rest of the NTD community, to a large extent, actually adopted the way the Alliance for the Elimination Blind of Trachoma was working.
The next the next reaction would have been from the community of practice. How did they react when this was adopted to the agenda?
Well, they reacted very positively, and actually at the beginning, the way the things were happening, the different DZs would have their own meetings, and basically they were discussing very similar things, and the people who are discussing were the same people. So at some point it was like, well, it doesn't make sense that we are discussing very similar things in different places at different times. So it started just by having like meetings where people would on Monday discuss trachoma, on Tuesday they would discuss onco, on Wednesday they would discuss schistosomiasis, etc., etc. And then there was this realization that all these things could be integrated, and by being integrated means that a lot of things that are actually relevant to all these different diseases. It doesn't mean that it's about doing everything at the same time. It's really about optimizing the resources, and I think that's a very important kind of lesson to be learned. So that's it's not mixing things together. It's making smart decisions about working together.
Great. So following the inclusion, then, what new opportunities surfaced, and perhaps there were many challenges that still remained. Did you all see that there were benefits to bundling with the other NTDs? You kind of mentioned this in the last question, but maybe there were some other benefits that you could touch on.
There were indeed several other benefits, and one benefit was that it allowed the NTD community somehow to speak with a bigger voice, and also for the NTD community actually to have good examples of what is actually working. And in that respect, trachoma and onchocerciasis were very good examples. So in terms of advocacy, these were a very strong point. It's like if you invest in these areas, there are some guarantees that it is actually going to work. Another important point has been that community was working together. They were really collaborating and kind of self-coordinating themselves. And that has been taken very positively by the major donors, because again, in terms of trust, it was very important to think that it would be possible to work with a community of people who kind of speak the same language, understand each other, are not competing. They're trying to create synergies rather than competition. And that actually led a significant increase in the amount of resources that were made available to fight against the different NTDs.
That's great. So you talked about the funders and kind of that global development funding landscape. How has that shifted today? I mean, we know that there's kind of a shift with global health and all of the things based on pandemic. Is there something that you see that has immediately shifted already in this area?
It's a bit early to really figure out what is actually going to happen. But looking kind of at what has happened is that it all kind of started with some very big donors such as USAID on the one hand, and then the DFID, the British government fund, supporting very large programs in the NTD area. And it all started very much about like supporting individual conditions, individual diseases, and then the transition went to a much more integrated approach to support. It has also attracted funds coming from philanthropists, and that has been really very extremely helpful. And many other kind of foundations and NGOs. The risk that we could see even before the pandemic outbreak was that there might be like a fatigue. A growing number of countries are now reaching the point where they are validated as having eliminated these conditions as a public health problem. And the danger that we can see is that the risk is that we will probably end up with a small number of countries where the environment is very difficult, including because of security, where probably there will be a need for something like 10 more years of interventions, or a very big country like Ethiopia. So we see that there will be very hard nuts to crack. And we had concerns about the continuity in the funding. And indeed now with what is happening and with the shift in the priorities, this is probably going to be a challenge, except if we manage to somehow demonstrate or make people understand that the fight against the neglected tropical disease is mainly actually about strengthening the national health services, the national health systems, and I think that's really the kind of the way that we need to make absolutely sure that whatever we do is also contributing to strengthen the health systems, because in that way the NTD work will remain relevant, including in the new environment.
That makes sense. Thank you. So, in like fashion to the way trachoma came onto the NTD agenda, how do you believe the shift in landscape will affect expectations for the inclusion of glasses in the assistive technology agenda?
I think it's an extremely good point, an important point. I can see certain similarities between ACT, the assistive devices movement, and the NCD movement, is that they are, both of them are somehow corresponding to something that's been neglected, yet extremely large. Like I was pointing out that the NTD was about a number of conditions that were actually very important in terms of burden, but not seen because most of the attention was going to the three kind of darling disease. It's a bit the same with the assistive technologies and particularly the glasses. It's a huge problem. I mean, the lack of glasses is the first cause of vision impairment in the world and in most of the countries. The impact is huge, but yet it is not perceived as being an important public health problem. I think by joining forces with other areas in the assistive technologies will make a difference, because we somehow manage to speak with one voice and demonstrate that we have the solutions. We know how to do things. We know how to deliver, but we need a lot more resources. I think this is something that could work.
So I guess the next question to me would be, how does the greater community partner with ATscale in order to create and continue this momentum for the provision of eye care and eyeglasses?
If I build on the experience with Trachoma, Onco, and the NTDs, etc., I think building a proper coordination mechanism is very important. Nobody likes to be coordinated, but still there is a need to create synergies. So I think it's important to figure out how we can make sure that the different areas are working together and not competing together. Not competing. Another important point, I think, is to make very clear what are the different strategies that will be put in place in order to deliver. Because again, from a donor perspective, it's very important to know that the people who are involved in that area, they are not only working together, but they're working according to clearly established strategies, guidelines, which makes that the outcome will match the expectations.
So I guess my last question to you, Serge, would be, is there anything else you want to share with us that we didn't cover off on? We've covered a lot of ground here, and I appreciate your voice. It's an important voice.
Thank you, Kristan. I think we covered everything. Maybe the only thing that I would like to add is about the fact that it is very important to have WHO in the driving seat, because, and I'm not saying that because I used to work for WHO, but because I know by experience that countries, and especially the low and middle income countries, trust very much what WHO is doing and recommending. And nothing can happen without the involvement and the active involvement of the national programs, of the ministries of health, ministries of welfare, trade. I mean, it's very much about the multi-sectoral issue. So working with WHO helps the countries to develop ownership in that.
Great. Well, thank you so much, Serge, for your time today, and we look forward to more conversations with you in the future.
Thank you, Kristan. I look forward to continuing to work together.
Our next speaker, Chapal Khasnabis, is a prosthetics and orthotics engineer holding a master's degree in rehabilitation science from Strathclyde University in the UK. He is currently working to complete his PhD from Trinity College in Dublin. Chapal started his career in India with the Ministry of Health and then worked with the Ministry of Social Welfare. In 1994, he founded Mobility India in Bangalore to enable, empower, and include people with disabilities everywhere. Since 2003, he's worked with the World Health Organization, where his work has taken him to more than 100 countries. Since 2014, Chapal has led the WHO's Global Cooperation in Assistive Technology, also known as GATE, initiative to improve access to assistive technology for everyone, everywhere. In 2018, he facilitated the formation of the Global Partnership for Assistive Technology, ATscale. Chapal's current role includes developing the first WHO-UNICEF global report on assistive technologies. Good morning, Chapal, and thank you for joining us for this discussion about the change trajectory for eye care. Could you please describe how the WHO and your work is building on lessons learned from other fields and issue areas?
Thank you for giving me the opportunity to explain our journey, our mission, our work. To specific to your answer, I think learning never ends. We are still learning. We learned a lot from health sector response and beyond. We saw the whole access to assistive technology issue through a developmental lens, beyond disease and disability. On one hand, we are studying the demographic shift, and on the other hand, we are looking at the key success drivers for impactful change, big change. For example, in terms of demography, we are looking at how the childhood blindness, deafness, to hearing and vision loss of older people as we age, all of us age, and we gradually functional decline we experience. And in terms of success drivers, we try to see the impact of essential medicines list, market shaping, creation of organizations like Untitled, Gavi, the Vaccine Alliance, and at the same time, community health or community-based intervention, Convention on the Rights of Persons with Disabilities, and many more. And through these studies or learnings, we had two major learnings. One is mainstreaming, and the second is dare to think big. Small is beautiful, but big is more useful. To ensure mainstreaming assistive technology alongside medicines and other health products, we position assistive products as essential health products and moved all the activities under essential medicines and health products division. In older days, it's known as a cluster in WHO. And perhaps the biggest gain has been positioning assistive technology as a public health development issue, again, beyond disease or condition or eyes or ears and legs. Thank you.
So as a founding member of the steering committee at ATscale, can you share why this was the moment? Why today to create a global partnership around assistive technologies?
As I said before, among many success drivers, setups like Gavi, United impressed me most. Hence, thought of having a larger partnership beyond WHO. WHO alone cannot solve everything, especially when the demand is huge. The need and unmet need for access to assistive technology is so huge, which WHO alone would not be able to answer. Hence, needed larger partnership. Hence, thought of developing a global partnership for assistive technology or ATscale, like Gavi for vaccine. Besides, it's more than 14 years since the countries adopted the convention, CRPD, Convention on the Rights of Persons with Disabilities, which talks about rights to access to assistive products. 163 countries who have ratified the convention, which means they're morally and legally responsible for ensuring, facilitating access to assistive products. But in reality, very few actually honors it. World needs larger advocacy movement to create demand, at the same time offering solutions for making high quality assistive products are affordable and available in countries. only a true global partnership can ensure that. We are also 5th year of the Sustainable Development Goal. Especially look at global Goal 3, health and well-being, or 3.8 in particular, achieve universal health coverage, access to safe, effective, quality, and affordable essential medicines and vaccines for all. And full stop. What about medical devices and assistive products? They're missing. So that's what we thought. We need a larger advocacy movement to make people understand that essential medicines and vaccines cannot be solution for everything. We also need medical devices and assistive products, especially to ensure well-being. Hope this answers your question.
Yeah, very clearly. Thank you. So how did you come then to the conclusion that eyeglasses should be one of the 5 assistive technology products prioritized within the WHO? I think for us in the industry, it's fascinating that eyeglasses have finally made the list. Tell me why now and why in general.
Life was a bit easy compared to, because when WHO was developing the priority assistive products list, we carried out Delphi research as well as global survey. And throughout this whole process, the number 1 was always eyeglasses or spectacles. So there is a huge gap even between the number 1 and 2. So it was quite evident and clear that the most health products people need is the eyeglasses. But besides, in 2016, I met the co-founders of EYElliance, who shared with me their recently released report, Eyeglasses for Global Development, Bridging the Visual Divide, that was published in the World Economic Forum. And I was very impressed, not only with the report, but the way report was made and its ambition. The report made a compelling case about the cross-cutting impact of correcting visions with spectacles, alongside the existing data on the economy of the need, which has recently matched by the latest global figures from WHO World Report for Vision. EYElliance was a natural collaborator because they are a neutral broker representing their experience and learnings from leading eye care NGOs around the world. I even noted the need for a similar entity to be convened for hearing aids, mobility aids, and others. So I was, in fact, jokingly said, okay, we have an EYElliance, now we need hearing alliance, we need a mobility alliance. And actually, that all culminated into the ATscale. We also wanted to be fairer and equitable to all major groups. The main categories of functioning difficulties that AT users had, for example, vision, hearing, mobility, communication, and cognition. And if you see top 5 products, spectacles, wheelchair, prostheses, hearing aids, and tablets and software, actually the top 5 most big 5 products, which makes a big impact and big difference in people's life, is number 1 to 5 in WHO's list of essential priority assistive products.
Great, thank you. So from that, what lessons or insights would you share with the eyeglass community of practice? Can you provide practical advice for how the community could be supportive partners to the AT community of practice, and how could we help make the case for additional resources?
Recognizing that successful approaches to eyeglasses delivery have been piloted and proven. For example, I would encourage all NTDs, including NGOs, to work with ministries of health and also some Ministry of Social Welfare and Education towards fully integrated eyeglasses provision at national scale across the country for everyone, everywhere. And at the same time, look beyond medical intervention, cataract surgery in particular. Eye care actually quite a bit overtaken by only cataract surgery. Also, I suggest that we should need to look beyond eye. Diabetes is a good example, or say onco and trachoma. Provision of a white cane and other assistive products, especially the low vision products, to support senses other than sight, like alarm signalers, talking watches, orientation and mobility training, all are important. So don't focus only in one particular piece or one particular organ or one particular disease, look beyond. So whatever people need, try to provide all. Otherwise, even eyeglasses, even successful provision of eyeglasses or spectacles or low vision aids will have its own limitation. Eyeglasses or spectacles are clearly the product with the highest priority and the need with respect to vision. And the WHO sees that as the entry point for introducing other assistive products in relation to this category and beyond. We hope now with the effort and progress has been made in many countries in provision of eyeglasses, we see from India to Liberia, especially by NGOs and even the companies, private entities, foundations. It's amazing that global community, so that the global community will broaden the scope to include other AT products for low vision and blindness, such as magnifiers, white canes, filters, and so on. The group of products have been really neglected. This group of products, people quite often focus on spectacles or glasses, not much on the magnifiers, low vision aids, white canes, filters. But these are also essential. This group of products has been really neglected, causing access rates to them to be almost non-existent in most low-middle income countries. And as a response, we are working on tools to support countries and the government to improve access to these all essential assistive products. Not only eyeglasses for eyes, but also other devices which can supplement or complement vision. We have really united the assistive technology sector and brought together groups which have historically seen themselves as independent from one another. These sectors are all individually very small. For example, wheelchair, hearing aids, vision, prosthetic orthotics. And we have seen the power of having a collaboration and collective voice at the same time. And of course, this is absolutely in the interest of service users who must navigate complex and separate systems to get the AT products they need for their functioning difficulties. More and more relevant for older people. 21st century, the health scenario is quite different than 20th century. More people will have a multi-morbidity, more issues related more than one functional domain. So people who need glasses, they also need hearing aids. And we cannot tell them, for hearing aids, you go one place, glasses another place, and mobility aids another place. Try to see all these are available at single source. So by piloting our new community level training modules, so we are developing training models which can offer the solutions at the primary healthcare level, community care level. So by piloting our these training modules, we have witnessed that even at the primary healthcare level, there is a strong demand from the health workforce and service users for training and provision across a range of simple assistive products. Through this exercise, we have found that many people need other assistive products in addition to eyeglasses, and those also needs to be provided through the same facilities who are providing eyeglasses.
So you mentioned that each of the individual sectors, each of the individual groups is very small, but what are the benefits and challenges you've seen involved with advancing an agenda involving 5 products?
You know, if the number is small and intervention is specific, is scalability and provision scope across the country also becomes less and gets lost among competing agendas. Acceptance of medical specialists also a big challenge. Most people think it has to be provided by the specialist, for example, eyeglasses, it has to be ophthalmologist, but they don't exist everywhere in the country. And the same scenario is supporting organizations, departments, it has to be done through ENT departments, specialized people. And those ENT departments don't exist in the primary healthcare and community healthcare setup in most countries. So it is real challenge is how we can go beyond these traditional silos or comfort zone. We also need to see that look beyond this, our own specialized area. So we need to ensure that other essential assistive products outside these big 5 are not ignored. We need to ensure AT gets recognized as an essential health product and as important as medicines and vaccines for people in need. And also provision of this becomes an integral component of universal health coverage so that no one really left behind or to be left behind. See, you have to understand how the health sector organizes their priority and the budgeting. It's mostly done seeing the number and the impact. So if these small sectors don't unite and come with a big number, they'll never gain the priority in terms of budgeting. And if there's no national budget behind, we'll never be able to develop a national program. So that's why the benefit comes. We can create greater visibility, greater access, and it helps people outside the sector immediately relate to AT. Market shaping efforts of these top 5 products and learn lessons that we can apply on the narratives for other products. Because we have to make these products affordable. In many countries, if you ask the country or the people why they cannot access, first they come with a cost. One is the lack of services. Second is the cost factor. So only if we can come together and create a big market, and we know once the market is big, prices of the product goes down. So once we can create this big demand, there's a big need, but demand is not there. So by coming together, we can create a big demand. We can show the industry, we can show the government, we can show the people that it is possible. And through market shaping, you can cut down the price. Through task shifting or task sharing, you can create the other groups who can provide these simple devices at the primary healthcare. It will be win-win for all. It will be win for the industry, it will win for the government, it will be win for the people. And that's how the equation, we are working on triple win formula, win-win-win, to ensure that everybody benefits as ultimately people benefits through our effort. Thank you.
Thank you so much, Chapal. This was extremely informative, and we're so excited to see that eyeglasses have now made the list. Thank you for all your hard work on this as well.
Thank you. It's with pleasure and honor.
Our next speaker, Alison Fineberg, is the director of ATscale, the Global Partnership for Assistive Technology. She's focused on maximizing the potential of this cross-sectoral partnership to reach 500 million more people with life-changing assistive technology by 2030. Alison has 10 years of experience in international development and global health-related work. Prior to joining ATscale in November 2018, she spent 7 years building and leading multicultural teams for the Clinton Health Access Initiative, or CHI, partnering directly with ministries of health in Nigeria, Swaziland, and Laos, PDR, to strengthen facility and community health systems. She later used her in-country experience to inform her work in CHI's global operations team. Alison has experience increasing access to medicines and diagnostics, introducing innovative testing and treatment programs, like the early access to HIV treatment for all, and developing overarching strategies for systems strengthening and improving global operations. Alison graduated from Dartmouth College with a degree in biology and neuroscience. She lives in Geneva, Switzerland with her husband and her 2 children. Hi, Alison, and thank you so much for joining us today for our discussion.
Hi, Kristan. Thank you so much to you and to the Vision Impact Institute for inviting me to speak. I'm really grateful for the opportunity to be included in the discussion on this really important topic.
So tell us first a little bit about ATscale. What is it actually, and what is your mission? How do you do your work?
Great. Well, so ATscale, the Global Partnership for Assistive Technology, is a cross-sector partnership bringing together bilateral donors, UN organizations, and other multilateral agencies, disabled persons organizations, non-governmental organizations, and governments of low and middle income countries, and others to focus on a key topic that needs increased focus and prioritization globally. When I say assistive technology, I mean the devices or the products and associated services that help users live with greater autonomy and choice by facilitating daily activities that they would otherwise be unable to do or to do to their full potential. And these include products such as eyeglasses, hearing aids, and wheelchairs. And today, well over 1 billion people need at least one form of assistive technology, but over 90% of those people do not have access to the assistive technology they require, which is important, of course, for participation in education, work, family, and community life. And we know also that the need is growing and it's disproportionately high in low and middle income countries. So in response to this huge unmet need, ATscale was launched in 2018 at the Global Disability Summit. It was bringing together partners who've been focused on assistive technology and other topics related to supporting people with disabilities for some time, as well as actors from the global health space who were just starting to recognize that this was a new topic that they needed to prioritize. And some of these global health players saw potential in applying approaches such as market shaping, which have been used very successfully in other health areas to dramatically increase affordability and accessibility of products such as antiretrovirals for HIV, bed nets, and vaccines for childhood immunization. We know that access to assistive technology touches many people, both those who will benefit from them directly and also their families. And so as ATscale, we're focusing on increasing access to assistive technology for all people who need them, including people with disabilities, those with loss of function, non-communicable diseases, and the aging population. And our vision at ATscale is to enable a lifetime of potential where every person can access and afford the life-changing assistive technology they need. We've set an ambitious goal. We want to catalyze action to ensure that 500 million more people globally are reached with this life-changing assistive technology by 2030. To do this, we'll address what we call the enabling ecosystem for increased access to assistive technology. We want to increase political prioritization and political will for this work, providing the case to leaders everywhere that this is a fundamental and critical topic for all of us. We want to mobilize resources from both current and new actors to address what has been an under-resourced sector for some time, and encourage collaboration so that we're working with common strategies at all levels, global, regional, and country levels. And we also want to build and shape markets. I mentioned that possibility of applying market shaping approaches. So we want to make it more possible for individuals to access high quality, appropriate, affordable assistive products and services in the countries where they live, particularly in low and middle income countries. And to do so, we'll make targeted investments across the AT space to overcome markets and system challenges. And this means both working in country on the systems and services, as well as working on the supply side with manufacturers and suppliers.
So not a small job. It sounds like you have a great work ahead of you, and thank you for the work that you're doing here. I see that you recently released a product narrative on July 30th. Can you tell us what a product narrative is, and then how will this benefit the work of ATscale?
Absolutely. We have initially prioritized 5 priority products and services, which were selected through an analysis and assessment of the World Health Organization's priority assistive product list. And these are wheelchairs, eyeglasses, hearing aids, prostheses, and assistive digital devices and software. And there are 50 priority products on that list. ATscale initially selected these 5, considering both unmet need and the potential for impact using market shaping approaches. One of our partners, the Clinton Health Access Initiative, is conducting what we call a market and sector analysis for each of these priority product areas, informed by many different experts and organizations in the sector. And this analysis is done to support us in understanding the barriers that we need to overcome in order to dramatically increase access to affordable and appropriate products and services, particularly in low and middle income countries. So the analysis and the strategic approach that emerges from that is what is captured in a document that we call a product narrative. And as you mentioned, on the 30th of July, we launched the eyeglasses product narrative, and on the same day, we launched one for prosthesis. And this makes the 3rd and 4th product narratives in a series of 5. So we will use the analysis and the strategic approach captured in these documents to help us to select the initial interventions or activities that we will invest in to help us reach our goals. We also hope these documents will inform others' investments and actions in the sector. In the first few years, these interventions will be quite foundational in nature. We could focus on strengthening global policy guidance, for example, around service delivery standards, to help increase adoption of innovative approaches to screening and provision of eyeglasses with a focus on simplifying service delivery. We also understand it'll be important to focus on integrating services into national programs, and therefore we'll look to support low and middle income countries in planning, budgeting, and implementation of costed eye care plans, for example. And this will likely also involve supporting the scale up of promising approaches such as screening and provision through school eye health programs or vision centers. And we'll also look to do things such as expanding delivery of affordable quality eyeglasses and services through partnerships with the private sector. While we recognize we're not addressing the extensive list of assistive products that people need, we anticipate that focusing on these 5 products and their related services should enable us to reach a significant number of people who will benefit directly from these eyeglasses, wheelchairs, and hearing aids. And at the same time, it will allow us to strengthen the systems that are important for all assistive technology more broadly.
Alison, is there anything else that you might want to share that we didn't cover?
I just wanted to share that I've worked in global health for quite a long time, and it was only in 2018 when I was approached about ATscale launching as a new global partnership that I realized that assistive technology was a topic that I needed to focus on. So for me, it's really exciting that we're having this conversation, that we're talking about increasing access to eyeglasses and to assistive technology more broadly. It's exciting that assistive technology is being talked about in the context of global health and other international agendas. And we certainly have a really long way to go, but I think a discussion is a really good start. I think we all have a role to play. So I'm excited to really get going with more of this work.
Well, congratulations on all you've accomplished, and your passion certainly shows through. So thank you for your time, Alison. We'll talk soon.
Thanks so much, Kristan.
Our final speaker today is Liz Smith, co-founder and chief executive of the EYElliance. Over the last 12 years, Liz has worked in international development with a focus on inclusive business and increasing access to global markets. Prior to her work with EYElliance, Liz spent 5 years consulting with the UN Office of South-South Cooperation, forwarding the work of the Creative Economy for Development agenda. In 2011, Liz joined Vision Spring as Director of Business Development, where she and Vision Spring's founder began their initial exploration of the viability of a cross-sector collaboration to close the gap in access to eyeglasses on a global scale. Liz graduated from the University of Vermont with a BA in Environmental Studies, is a member of the Explorers Club, and is a two-time National Geographic Society grant recipient for her work documenting endangered song.
Hi, Liz. It's always a pleasure to speak with you. Today, we're excited to explore your views on the priority of vision care and the next steps in the access story.
Thanks so much for having me. It's great to be here.
So can you tell us a little bit about EYElliance's goal of elevating this issue area beyond health and making the case that it be prioritized by the global development community?
Absolutely. The initial concept that became the impetus for EYElliance was the simple premise that in order to address a problem of this magnitude, a global collaborative initiative would be required. We were inspired by both the Partnership to Control River Blindness and the Partnership to Eliminate Trachoma. But we also spent several months researching how other issue areas like malaria and nutrition formed global partnerships to tackle a problem at the population level. Now, armed with this knowledge, in early 2014, we convened 25 leaders from the eye care community of practice, academics, donors, USAID, and the World Bank. Now, the purpose of this meeting was to gauge interest in establishing a new global partnership that would close the gap in access to eyeglasses. There was a clear appetite to launch a new initiative. And at that first stakeholder meeting, we were also tasked by the group to prioritize elevating the need for eyeglasses beyond health. Now, this call to action was based not only on the long-standing neglect of our issue area, with medical interventions historically prioritized over the provision of eyeglasses, but also because of the potential to leverage the cross-cutting impact that glasses have on educational outcomes, worker productivity, and road safety. Today, EYElliance is a multi-sector coalition of actors that includes NGOs, the private sector, government, multi and bilaterals, that drive the global strategy to close the gap in access to eyeglasses. And over the past 5 years, we've succeeded in bringing leaders from global development community into the solution. We are particularly proud of our work with the Global Partnership for Education, a funding platform that strengthens education systems in developing countries. They now see school eye health as an important component of country-level education plans. Also, due to our efforts, both the World Bank and UNESCO are now prioritizing school eye health as part of their inclusive education agendas and commitments. And of course, our work with Chapal at the WHO and now ATscale has resulted in the incorporation of our strategy on how to close the gap in access to eyeglasses into a broader AT agenda that also includes new sources of funding.
So tell us a little bit about how the EYElliance actually began its collaboration with GATE at the WHO.
Yeah, as Chapal mentioned, we were fortunate to be introduced to him by a colleague following the publication of our report, Eyeglasses for Global Development, that was published by the World Economic Forum. During that first conversation, as we shared the findings of the report, the commonality in our approaches to accelerating access became so obvious, and we immediately saw ourselves as partners in arms. Now, it was not long after that conversation, we began collaborating on the development of an e-learning module that trains community-level workers to conduct basic vision screenings and dispense reading glasses. Over the past 4 years, since first being put in touch with Chapal, we have stayed in close communication with GATE, sharing new data as our evidence base grows and as we gain new insights into viable scaling pathways.
So what excites you most about the inclusion of access to eyeglasses in the AT global agenda?
We see the inclusion and prioritization of eyeglasses within the AT movement as a game changer for our issue area and critical to our ability to continue to drive momentum. ATscale's market-shaping approach is fundamental to creating a world with equitable access to eyeglasses. We've also been very encouraged by the new prioritization of eyeglasses provision as part of the WHO's World Report on Vision, and the recent resolution at the World Health Assembly emphasizing integrated eye care services at the primary level. However, a problem of this magnitude can only be addressed if a broad set of actors are engaged, deploying and funding proven solutions delivered across multiple platforms. With eyeglasses now an integral part of the AT agenda and gaining significant traction within the global development community, I am super optimistic that we are close to finally ensuring truly equitable access to this 700-year-old technology.
Thanks again so much for being with us, Liz. It's always great to talk to you, and I look forward to talking to you again soon.
Thank you.
It's clear that so much valuable work is underway to ensure that good vision is a priority for all. To learn more on this topic, visit visionimpactinstitute.org. Go to our blog and click on the post titled 5 Reasons to be Excited About the New ATscale Product Narrative. Thank you to all of our guests today, and thank you for listening.